Coronavirus continues to be a major concern across the country, especially as we see new cases persist every day. Dr. Tom Hopkins is keeping a close eye on the situation and joins us now to share his expert medical perspectives and tell us what we need to know on the heels of a report that there's a new drug that may help combat COVID-19. Welcome back to the show, Dr. Tom.
Hi, how are you doing? Good to be here.
Yeah, so tell us about this drug, dexamethasone, I think I said that right, and how it can supposedly help fight COVID-19. Is that right?
Yeah, first of all, let me tell you, dexamethasone is a steroid. It's been used in chronic conditions, a variety of chronic conditions. It's really been used also in people who have respiratory distress, exacerbations of asthma, in a hospitalized setting. So it's not like just prednisone by taking it at home is going to help prevent or specifically just treat COVID-19. The dexamethasone is treatment inside the hospital and has been shown to help people that have COVID-19, that are having respiratory problems by decreasing the inflammation. So it's a steroid used in hospitalization primarily.
How important is it for people to really do their own research and listen to the medical professionals when they're hearing about, a possible cure or some of these treatments?
Yeah, there's a lot of anxiety out there about that. Sometimes you have to just turn off the TV and not listen to the radio and just kind of, keep your bearings about you. But pay attention to the guidelines. The guidelines have been helpful. Remember, the things that led us to be successful and preventing the spread, social distancing, face covering are very, very important. There's a lot of misinformation that had been out there, but just pay attention to the things that are really, get reliable sources that are really going to there's no cure. Vaccine is not available yet, so don't have that type of expectation. There's some things that are on the horizon, they're working on it, but we just have to hunker down and do the things that we know that make a difference of wearing facial covering and adhering to, the social distancing.
Right, and yesterday, Governor Newsom, he was pretty fired up. He was talking about the sharp rise in cases this week in California alone. Why do you think we're still seeing those numbers keep going up?
Well, we had them where they were kind of flattened, but of course there has to be a correlation with all of us saying, okay, we started opening up, right? When we open up, we kind of started to let our guard down a little bit. There's also talking about we started to let our guard down with getting together with our neighbors and whatnot and think we didn't have to adhere to facial coverings and social distancing. This is showing us that we really do need to do that and have to adhere to it. Even though it seems like it's inconvenience, wear the mask, facial coverings, wear what's going to be comfortable. This is going to be very, very important in helping us decrease the spread and decrease and have these numbers fall down. So we have to continue to adhere to those type of guidelines, social distancing, wearing facial coverings. And if you have symptoms or feel sick, stay home, isolate yourself, get a test when appropriate, because it's important for us to know where the cases are and to do contact tracing as needed.
Tom, that was going to be my next question, because most people hopefully know that it is a mandate here in California to wear those masks in public. So you agree with this?
Yeah, I agree with it. When we're talking about what's going on now, and we know we've opened up, we've had several episodes of significant gatherings where people weren't wearing masks and they weren't adhering to social distancing. We have to understand there is an impact of that. COVID-19 is an opportunistic killer. So the opportunity is for each of us to our behavior, be responsible for our own behavior. And a lot of that is, of course, adhering to these guidelines, wearing masks, social distancing. We shouldn't have to be kind of, fighting the system when we know that this is something that's going to be beneficial for all of us.
Well, you talk about wearing that mask, essential and very important. Any other advice you can offer when it comes to going out, now that businesses are reopening, we can actually go in businesses and shop and things like that?
First of all, I would say don't fear going out, first of all, because you have a responsibility of what you can do to protect yourself. Wearing a mask is part of that. Remember, I wear a mask to protect you. You wear a mask to protect me. If we both wear one, we protect each other and we blunt the spread. So we just have to pay attention to social distancing, being aware. And I have to say, on the good news of this is I see it all the time that people are doing just that. Social distancing, businesses here, Placer County, specifically Sacramento County, where I'm involved with, I see them doing it. So folks, young people, pay attention to these guidelines. Don't think that, you don't have any symptoms, so you're fine. You could be carrying something, COVID-19, and, risk the health of your elderly folks that you visit. So everybody, we're in this together. We got to stick with it.
Great point, great point. You wear it to protect me, I wear it to protect you. All right, Dr. Tom, don't go anywhere because we're going to have you stick around with us after the break. We're going to have a few more questions for you.
All right.
Now we want to welcome back Dr. Tom. He's still here with us, and we've been talking about coronavirus and where we're at with it right now. Thanks for staying with us, Dr. Tom. We really appreciate the expert insight, and we have more questions for you. Early on, it was being said that children, they were more resistant or less likely to be affected by COVID. Is that still true?
Well, as the coronavirus pandemic has spread, we're seeing, and I've mentioned that COVID-19, it has an opportunistic killer. So everyone has the ability to be infected by COVID-19. We know that kids are not immune to it, that they are at risk. They're just at a lower risk. So we're all really in together. We know that people who are elderly are at high risk. We know the people who have conditions such as diabetes, hypertension, poor health, immune system dysfunction, they're at higher risk. But we're all at risk. And the pandemic has spread, we've seen that even the younger group from 18 to 30 now, we see that we have increased cases. So it can happen in children, fewer cases. There's some mysterious illnesses that have happened now that were COVID negative, but suspicious on that correlation in those young kids.
Yeah, and I think people need to keep in mind, this is still really new for the medical community too. So just as we're learning, you guys are working as fast and hard as you can to get as much information to us of the facts. Now, we've also seen that uptick of COVID-19 cases, particularly in African Americans and Hispanics. Why are those communities being affected more?
Well, we know that this brings up the issue that has been present. We've known about it. Social disparities, disparities that happen in socioeconomic groups. So we know that this is a product of not good access to healthcare information. There are populations, the high risk. These folks, a lot of are high risk. They have diabetes, hypertension, and so the information hasn't received to them. They haven't perceived that there's a risk, and we need to get that information out to them so that we have good access to healthcare, equal screening that we have the opportunity for everyone to do it, and then identify symptoms and really empower those folks to understand that they are at high risk and to do something about it with social distancing and wearing facial coverings.
Well, another thing, summer's here and people, they want to get out and about, even travel. What do you say to people who are planning to travel this summer?
Well, first of all, again, I say don't have any fear, but just be empowered to know where you're going. If you're going to travel to a place that has a higher risk, the cases are going up, I would be cautious about that. Understand now with this recent travel ban that it issued from New York is that if you are from a high area where there's a lot of cases that are increasing, you may travel to these areas that tell you're going to be quarantined for 14 days. So you have to adhere to that and understand that all of these strategies are just to help decrease the pandemic. But in terms of going on a plane, which I recently traveled on, there's requirements for facial coverings. You should adhere to that. They're doing all these things to social distancing. They're doing that. They're sterilizing and cleaning the airlines and the whole airport. So I don't think we should be fearful of that because those things are in place. What's left is the personal responsibility, wearing masks, not fighting the system about getting on a plane. You're going to travel, you're going to be required to wear that facial covering, so just do it. And expect if you don't, they're not going to let you fly as they should.
Great advice, Dr. Tom. We always appreciate you joining us here on the show. Can't wait to have you back on. I'm sure we're going to have more questions. Have a great day.
All right. Okay. Bye-bye now.
All right.
This interview involves commercial content. The products and services featured appear as paid advertising.